Well, hello again. I think that we have great panelists to discuss about the Liquid Hospital today. So, better than me introducing all of you, I think it's better that you do it yourself. I'm sure you do it better, so please, Patricia,
Okay.
do you want to start?
Thank you, Christian. It's okay? Yeah. Thank you. Well, I'm Patricia Ripoll. I'm patient advocate in migraine. I start in migraine, but later I start to work with patients in all of disease, because I see that the work that we have to do, the patients in all of the disease, it's the same. Then I start to work with hospital, institutions, and also organizations to work with the point of view of the patients. And then this is more or less. I was a commercial director in the pharma sector, and then I have to stop to work due to my migraine. And then this is the moment when I start to try to change the way of work in the organizations, and then after in the hospitals and all of the institutions, because I think the patient has to be not the center, it has to be one of the key and another part of the center and another part of the stakeholders.
Thank you. César,
Thank you.
please.
Okay, thank you. It's for me a pleasure to be here in the Barcelona Health Hub. I love to be in Barcelona, and for us, as I said, it's a pleasure to be here. In my experience, I've been running hospitals for the last 12 years, both in the public and in the private sector. And now I'm fully involved in this new project that is called Sham, an insurance company that we are specialized in the insurance of the health professionals. And as you say, the patient. Okay, for me and for us in our company, imagine we are always, and we had the point of view absolutely fixed in the patient. Not only in the patient, and both in the combination patient and professionals, because they can be, at any moment be apart. So I think this is a great moment to talk, because after the pandemic, the things are changing, or are supposed to be changed, and we have to start this new normality, with the learning of this past period. So, thank you for the opportunity to share with you this time.
Sure, thank you, César. Arnau, please.
Thank you. Very happy to be here today with such a panel. I'm Arnau Valls. I'm an engineer as a background and working for some years in Sant Joan de Barcelona Children's Hospital, a pediatric and maternity health hospital in Barcelona that you may know. And we've been running different strategies in liquid hospital and digital transformation. So we'll try to bring our experience on that.
Thank you. Nuria?
Yeah, so first of all, thank you so much to the Barcelona Health Hub for organizing this event. I'm also very happy to see some faces again. So I am Nuria, and I am the CEO at HumanITcare. We are a company based here in Barcelona, but working in Spain and also in other projects in Europe. And from those people that you don't know HumanITcare, we are working in the remote patients monitoring space. We are working with both public and private hospitals and healthcare insurance, and it has changed. I have to say that we will later discuss, but also we are experiencing now some of the challenges that I am sure that we will talk again. And my background is in clinical psychologist. I have a master in neuroscience, and I was working in the Hospital of Mar, in the Research Institute of the Hospital of Mar, as a research assistant, and then later I led some projects involved in digital health. And I see, together with the other co-founder, that the need, it was there, and yeah, we founded HumanITcare now 4 years ago.
Thank you. No, I think that we have great different points of view to discuss, but before starting, I think that it's important to ask you, what do you understand as the liquid hospital concept? So to set up a little bit the discussion. You want to start, Patricia?
Yeah. Well, for me, I think a liquid hospital, it's something different that probably the persons who work in hospital thinks. For me, it's something that it's a different way of thinking, because sometimes a lot of people think when they think in liquid hospital, they think in technology, input in technology, and I think when we think in liquid organization, we can talk about hospitals, or we can talk in organizations. We have to think in a different way of working. We have to talk about asking process. We have with this working with patients, and we can see also in Sant Joan de Déu that they are working like this. We have to work in a different way with persons, and also we have to work basically in a human way. For me, this is a liquid organization and also a liquid hospital. And of course, we have to use technology, because I think it's the way to arrive, but it's not the only way to arrive. For me, it's more important to use the human way to arrive to these liquid hospitals.
Sure, totally agree. And
yeah.
maybe, César, you have some ideas?
Yes, well, from our point of view, you know, as an insurance company that works exclusively in the area of the medical liability, I would like to, and related to the liquid hospital, I would like to point five important points. One of them is changes in the epidemiological profile. We are moving from an acute patient to a chronic patient with more disease and more fragile, so we have to take that into account. The second idea is the modifications in the social configuration. Society is much more demanding. They also have more information, and also they have more criteria to make decisions. So that is also very important. We have introduced the concept of self-care. The third point is it's concerned to the sustainability. Hospitals are expensive, and we could be spending less on burdensome means. The fourth point is the new technological tools. We have now this technology allows us to keep the patients safely out of the hospitals. Now we can have information in real time, even more in those patients admitted at home from those admitted to the hospital. And it's important to know. And the last point is we are facing a new business model. Healthcare professionals, they think that their job is unique and special, and that it cannot be changed, while other sectors like banking or insurance or care have changed the model. So we have to think also in that movement, you know, and that should change, no? And for the end, for me, the liquid hospital consists of decentralizing the healthcare provision from hospitals to community to primary and to home care.
Okay, good. No, you raised a lot of points. Arnau, well, you have already experienced making Sant Joan de Déu a liquid hospital, so I'm sure you can bring some more ideas.
Yeah, I think to complement what my colleague just said, we created the first project of liquid hospital in 2010, and the objective mainly was to go beyond the walls of the hospital, so try to not make the health so paternalistic as it was, and try to make it more collaborative so that patients can be involved, can take part on the decision making, and health not only should be presential at the healthcare site, but whenever or wherever the patient is. So that was the main objective. So we try to create the tools, taking into account patient first and the journey and professionals that can help them be more involved in that way. Also, we have the situation of being a pediatric and maternity health hospital, so our population is young, and that's something that pushes for a change. So we live in a digital world, and we think we have to change and rethink the way we provide and deliver health. So for me, that would be the objective, be more ubiquitous and efficient on the delivery of healthcare.
No, thank you. Nuria?
Yeah, so for not repeating what my colleague has said, I like very much this idea of decentralized because in my opinion, it involves that the patient has a responsibility and an active way to really like be involved in the process. And yeah, well, from the concept of liquid, this first concept was said by Bauman, which was one philosophy. So for me, this concept of flexibility, it is also involved in optimization to better improve also the way that we are delivering healthcare. We all know that the public healthcare is unsustainable because it has a lot of expenses, and this, for me, this meaning of liquidity means also this flexibility to improve and optimize how we do the things in medicine.
Thank you. No, to go a little bit deeper, and you talk about it already, what are the benefits for the patient? Because at the end, what we want is a better healthcare and the patient to have a better experience. Maybe, César, do you want to take the first shot on this one?
Yes, of course, thank you. Well, the patient, I think that the benefits for the patients are quite clear because when we take part of the system out of the hospital, from the building of the hospital, and we move closer to the patient, we are gaining many, many things. That getting closer to the patient is more important in terms of humanity, in terms of confidentiality with the patient, with the family of the patients. And I think that the professionals also feels that their job is changing, they feel more recognized. So, both gain in this movement out of the hospital. So I think that the patient is really the ones who gain in this new relationship that we would like to have in the near future.
Arnau, do you have any more thoughts on the benefits for the patient?
Yeah, I think not everyone is the same. Everyone is different, and also in the daily life of every person. So having a capacity to be more, to personalize more the healthcare delivery that we have, and accompanying the patient not only in the acute care, but from home to home, so in prevention, during the acute care, and afterwards, and with the tools that each patient needs, I think that can only be a benefit for the patient. So trying to segment more the type of healthcare that we deliver to each of them. And I think Liquid Hospital in it also have a way of thinking from the patient. So taking into account the journey and each patient needs, also the professionals, and on top of that, try to build a system and a solution that fits each situation.
No, I agree in this point. I think that no patient wants to be in the hospital by itself. I mean, they want to be at home, but it's a great way to extend this treatment to their house. And Nuria?
Yeah, here I also want to add something. When we speak with patients and doctors, and maybe some of you have experience, the first thing that they say, oh, but this concept of digitalization, I don't want to lose the contact with my doctor. I want to see the face. And speaking last week with some group of doctors that they have experienced telemedicine during the pandemic, they told us that for some patients it is very important to have this face-to-face. So for me, in this process of Liquid Hospital or digital transformation from the hospital, it is very important to not lose these needs that the patient have, because we know like that some of these meetings are also like a therapy for these patients to see physically the doctor. So for me, it's also like a kind of hybrid combination. And here we have to listen to the patients. Yeah, always.
Patricia.
Yeah, but I think here we are talking about liquid hospitals, but how many hospitals are like this? How many hospitals are really liquid? We know Sant Joan de Déu, but the rest of the hospitals, they want to be liquid, they put in their objectives, their vision, they want to be, but really, how many hospitals are really working with patients, like Sant Joan de Déu, that they work really with patients, and they have a chief patient officer, for example, or they work really with patients to take decisions, and they start to work from the beginning with the patients, with the ideas of the patients, to the patients what they want. They are all the time saying to get a real contact with the doctor, to arrive to understand the doctor and to have a human relation with the doctor in a traditional way. Then with telemedicine, they are going to arrive to have this real human relation. Then we have to work these soft skills with them, this digital empathy. And I think these things, we have to start to work from the beginning also with these digital startups, with companies like Nuria, with patients, to start to work how we can improve this relation, and also with the doctors, how to improve the capacity to connect in a digital way. Because if not, we are going to be worse like we start.
No, I think it's a good point. I mean, we are talking about tools. By itself, it's nothing. I mean, you have to use it right. But, well, I think that you all raise really interesting points. Going a little bit even deeper into that, regarding the patient experience, because I have been saying that many times. I think the patient experience in healthcare, it's the worst experience as a user that you can have in any industry. So I'm sure that we all see improvements there, but what with the concept related to the concept of liquid hospital, what should be the improvements? Not always be, but should be the improvements. Maybe Arnau, do you want to get the first shot, please?
It's a good question. I have to say that we have experts on patient experience. I'm not, but I will try to answer the question. I think it's having patient first, so thinking on them and trying to involve them on the process of definition and design. And not only, now talking about pediatrics, not only about adult and families and patients, but also pediatric patients. For example, we have a group in Sant Joan de Déu, it's the Kids Barcelona, are kids from 12 to 18 years old that are trained and involved to help on processes of clinical research or innovation. And in most of our innovation projects, first we start by asking if the unmet need, the proposal that we have, really it's how they see it, and if it's really a problem, and the proposed solution, if that fits that. So I think any process of innovation or implantation of a new have to take user first, and in that case in healthcare, that means professionals and means patients also.
Sure. Nuria.
Yeah, I agree with Arnau, and I also like one thing that he told before, that all of the patients are different. Like, we are going to be patients, all of us, and we are different. So for me, in my opinion, it's very important that the organizations are now thinking into the application of this concept. So we need the right roles inside of the organizations that ensures that this change is real. And for that, for example, last week I was in one hospital in the north of Spain, and they told me that they have implemented telemedicine and different solutions, but they lack of the roles that leads inside of the hospital this kind of implementations. And I am not talking about a project manager. I'm talking on a role that really ensures that the patients and the doctors are really they really want that. And this is very important. In the United States, we have a lot of examples of digital transformations, chief patient officers, and different roles that are needed. And if we want to change, we need to change also the roles on the organizations, and we need to start thinking in different ways. And also, another thing that I think is important is the attitude. The attitude of the management team, because if we really want to implement and if we really want to innovate, the attitude and the open mind, it's also very important, and I think that it's a change that organizations have to done, and the roles are very important for the good success of these implementations, in my opinion.
Patricia.
For sure, I'm very agree with Nuria, because if you don't change the mind how you are working, you are not going to arrive to where we want to arrive. I think it's very important to see where they are working like we want, like other countries, because we have a lot of examples where they have put a chief patient officer or another person. It not has to be a patient, but someone that it's linking this innovation in patients and doctors, because I think the organizations in the hospitals are always doctors, and I think sometimes the doctors knows to do medicine, but they probably don't know about organization and about transformation, about digital. Then probably we have to change a little bit and make something more horizontal. I don't have the name now, but something more transversal, okay? And then we have to make more team management, and then it's going to be better for the organization. And another thing that I want to add for the improvement of the users, of the patients, or all the users, because I think it's patients and the family of the patients, because I think it's very important, because we are talking about kids, but also in other disease, we have the family. And then we are sometimes forgetting these families. And then I think we have to get the space for these families, and then we have to ask the patients and the families what they want and what they need. Probably when you ask, you don't get the best solution, but when you start to work with them, you will try to find together this solution, the best one.
César,
Well,
do you want to add something else?
yes. Difficult. Okay. Yes, there are examples in other countries like Kaiser Permanente and other ones. But in my experience, I remember when we started with the School of Patients in primary care. And that was, I think, that should be the starting point of these, as we said, this centralization of the hospitals, no? Because if we don't make that movement to primary, and putting the doctors, the nurses,
Yes.
with the patients and the family of the patients, and start working with the same goal, I think we could be talking, forever,
Sure.
and we have to start with something, no? And I think that we have to push, the system, the actual system, in order to move in that direction. That is a good direction. Sometimes it's they forget, because it's difficult, it has to be with the persons that are involved in the project. You find one doctor or one nurse that is, very, worry about the patients, and start with the project. Then when she or he left, the project die, at the second day. So it's important to involve both the organization and to take this example that we already have, and don't forget that, improve them, and also push with the system, in that direction. I think so.
Well, I think, please.
No, just a little thing. It's important to start in this way, but at the same level.
Of course.
It's just important,
Of
because
course,
if we are with the School of Patients, but we are not in the same level, the patients, the doctors, the nurses, and everyone in the same level, because
That's the key.
that's the key.
That's the key.
Yeah,
Of course.
we are agree.
Absolutely agree.
Yeah.
No, good. And I think this leads somehow to the next question that I would like to ask to all of you. What do you think that now this is good for the professionals? Because, well, we have the two sides. We have talked a lot about the patient. I think that you are right. I mean, we should involve more the opinion of the patients, and the experience should be an objective in any healthcare provider. But we have the professionals there. They have to adopt these changes. So, Nuria, you want to start with this one?
Okay. Yes, so I think that it's, it is also like difficult maybe to answer in one sentence. What I am sure is that for the doctors is that they don't want to have extra work done with all of these new technologies. So they want to, as all of the workers, they want to do things simple, right? And in some cases, this kind of technologies have a learning, have a formation, and they have to start like doing new things and also like changing new procedures that they do. So for that, it's very important also to ask them. And Patricia has said very well, I think that these groups of, like before like starting implementing, we have a lot of experience, and you have said before, and you have showed the report of McKinsey that explains very well all the advances that during the pandemic we have experienced that are very good. It's a new wave, as you have said, but we don't have to forget that these doctors are workers also, and they are using the technology, and this technology has to be at work to do. It has to be implemented in the workflow of the process of the work. For example, telemedicine has to be counted as a visit, and also we will maybe talk later about the legislation, but it has to be in the workflow, right? And well, with some doctors that I speak from different parts of Spain, they told me that it has to be implemented in the workflow, and it doesn't have to be an extra work for them, to really like do their work.
Patricia?
Yeah, for me, I think, of course, we have to start to work with doctors like I want to work with patients. It's asking, and asking, okay? We don't have to suppose what they want, okay? But I think it's very important to see what is the situation, okay? We see, and after this pandemic, we see like we have a lot of burnout in doctors, okay? And the situation is that they have no time for patients, okay? And they want to have more times for the patients. And I think the solution is not technology. The solution is to give more time in a quality time, okay? And I think how we can do this, let's talk and let's try to get the solution, okay? And I think if we start from the beginning and talk to the doctor when you start your career, when you start to learn medicine, why you start this, okay? And what's your motivation, okay? I think 80%, they said, I want to be with the patient, I want to arrive to a solution, okay? And then when you change your mind, normally they said in the third year, okay, when they start to work in the hospital and they see the other colleagues, how they work with the patients and the way of working with the patients, then they see how they work and they work like the other ones, then they change the way of work, okay? Then we have to start from the beginning, back to the basics, like we say in marketing and everything, then back to basics, back to the first year of medicine, and then back to this point and start again and start to think, okay, back to the patient, and don't think how you work it with the patients in the hospitals and start again, okay? Then rethink about it and take the point of view of human. And I think if we start to work like this, you have to I don't find the word in English, reaprender, to
Relearn.
Relearn, yes. Okay, it's easy. Relearn. You have to relearn. It's not easy, but I think we have to relearn.
Okay. Well, just one thing. We are getting short of time, and we have a lot of topics to go that are really interesting. I would appreciate if you keep shorter your responses so we can do it more on a flow. César, please.
As I said before, one of my points was a new business model. So this means that the healthcare professionals, they have to change their mind. And as a society, we should make this mandatory for them. Okay, we're talking about the patients, but if we talk with the healthcare professionals, they are, I don't know if they are really aware of what's going on, outside the hospital, outside the system. So we have to start, in some way, pressing the professionals to change, to move in this direction. If we are waiting, until they figure out that this is going on, maybe it could be late. So, also with the patient, but with the professionals, and making the biggest effort as possible to move them to change, to rethink or to relearn how they are delivering the care to the patients, and always, in this direction.
Arnau, you want to add something? I think this is a very touchy topic.
Yeah, I think it's a good point. I think it's a challenge, in fact, what's the professional on that. And that's because I think all the things that we are talking now, all the examples that my colleagues mentioned, at the end touches one point, which is that a liquid hospital, at the end, it's about organizational change more than technology or other things. So that's one of the challenges. And we've seen that in the last 20, 25 years with the implementation of the EHR, professionals now dedicate more time to writing or after each visit than looking at the eyes of the patient. And I think that's something that we have to learn from that and try to change when we implement a new service or a new way of treating patients. Also this workflow, and how to teach also professionals how to deliver this new way of treating patients.
Good. So, talking about real experience, I would like to ask you what your real experience on this concept happening, because we have talked about it. I mean, it's new, it's happening, it's hard to happen because we have a great inertia from the system, and I understand. I mean, healthcare professionals are stressed, are overloaded, so asking to change, I mean, it's difficult. But what is your experience in the liquid hospital? And please keep your responses short this time. And to Patricia, you want to start this?
Nuria,
Okay, I can start.
Okay.
Yes. I have to say, to be sure, that we have all the experience in our website. In the blog, we always try to put the experience of doctors and patients, so you are invited to go to our website and see it. But just to be very short, so that people can also speak, I think that in our experience, we have seen that before COVID-19 and after the pandemic, there are like some hospitals and doctors that are very aware that it's important for them. And of course, there is like a lot of challenge, starting for, as César said, this new business model that it represents for the healthcare, because it's new. And here I have to say that the private hospitals or insurance that we are working, they see, and as they have this strategy it is easy to implement. And here, for example, with one private group, we have experience, and it is a pillar for them. And then the implementation from the hospital, it is important. Also the interoperability, that is something that I know that we will discuss later. But it's important, and it is something that it is something that it can done if the strategy from the hospital has this attitude. But that, for the other side, that's true that in the public system we need to redefine and there is like some procurements on this, But I think that it's something that we need to still work in, because we need a strategy, a public strategy for that also.
I want just add something that I think that we have to be aware the dangers. Okay, I think it's very good to put, for example, technology in this case. Okay, but something that it's very dangerous. For example, it's you can put an app to see the results. For example, we were talking yesterday. Dangerous to go to the results, just to put on the table.
Okay.
Okay, in my case, my personal experience, short. You know, at the beginning of the pandemic, I was the manager of the hospital in Córdoba, of San Juan de Dios. And imagine, you know, that time in the hospital. And we made some movement in those moments when we had full, the hospital was full, and we need to treat the rest of the patients that couldn't come to the hospital. And as in this case, with the philosophy of the Order of San Juan de Dios, we decide to go out of the hospital and start to treat, to do home care, delivering home care to our patients, to those patients. So this is possible. This you have to count with the professionals, but if they see the benefits for the patients, and the patients are also, you know, involved in this new business model, you know, there is light at the end of the tunnel, of course. It is.
Good. Arnau.
Good. I will explain one example. We had many initiatives going to that, involving professionals, even connection with other hospitals, involving patient and moving to patient home with the patient portal and other initiatives like websites to make them involved and give answers. But I will focus on one, which is diabetes type 1. We started the Liquid Hospital in 2010 with that, creating a website, a different way of treating those patients, and trying to provide them information so that they can be involved in their own care. Diabetes mellitus have an advantage, which is that it have a really clear outcome to see if that's going good or bad, which is the hemoglobin. And in that case, what we've done during these years is to try to segment the patients so that we can deliver to each patient needs and profile more concrete way of treating themselves. So not all have to have a glucometer or a pump, so with a closed loop. So during these years, what we've seen is that by segmenting patient needs and providing each of them the technologies, the treatment that they need, the results and the outcomes improve. And now we are moving to a point in which we created a cortex, so a command center, like a contact system in which from the hospital you can contact the patient. And the objective here is that we can have new roles like the nurse, digital nurse, that will take care of those patients at home while they are not in the hospital. So that if normally a diabetic patient will visit the hospital 4 times, those patients that move well with technology, that have family involved, maybe they don't need to come 4 times to the hospital. Maybe with 3 or 2, it's good, and they are better on their results. Otherwise, on another case, those that are not so stable or are in adolescence and they are less stable, maybe they need to come more. So by segmenting them and providing each of them a different way of treatment, you can have at the end the same visits a year in general, but better outcomes per each of those patients. But of course, that needs a lot of organizational change and business model around it to make it happen.
Yeah. No, and this brings to the next question, and I think that we already somehow responded. I mean, the next question is this is happening? And somehow it's happening, and then you have named it, but I think that it's better that we jump to why it's not happening so fast, because we already agree that we have benefits for the patients, that we have problems bringing that into reality of the hospital, but maybe you have more clues on what are the stoppers? What is happening? Why it's not evolving this? And we already mentioned, but I don't remember whose turn was that. You can start. But
Yeah.
yeah.
I think it's not easy to start with this kind of organization and to change the mind. It's different in public sector or private. Let's see, like something like Sant Joan de Déu. It's not private like private, but it's more private like not a public one. Okay, it's very different to work in this kind of hospitals. Then I think it's easier. In the public one, it's not so easy to change the organization. And I think another reason that it's not working, it's because it's not changing in the organizational team. Okay, they are not changing the way of thinking, and for me, it's the key. Okay, then if you don't change the way of thinking, the constant feedback, the active listening, then you are not changing.
Yeah.
For me, it's key, just to be
That's
short.
Well, we have to think in the long term, and that's one of the most important things. This is not one day work, no, one day job. So, and our politicians, are used to only to see, in the short, or even more, or even less, in the short term. So, this is, I think, the main problem. But as society, we have to make them understand that health is one of the most important. It's the most important for life. So they have to occupy in this transformation and this new model. Don't say business, just say care model. So, and we need to keep pushing, as from, every one of us, and try to make them understand that this is the way of delivering the care that we want, that we need, and that we will need for the future.
Yeah, I'd say that that's a cultural change. That's one challenge. Organizational change, it's a challenge. But at the end, if reimbursement don't goes with that, change will difficulty happen. So I think instead of being a pusher of it, it goes a little bit behind, and it's difficult then to reimburse some of the treatments of digital health that we are talking about. So until we don't have it, and there's an opportunity, because that could be a pusher of this change, it will be more difficult.
No, I totally agree, and I've seen that in reality happening. I mean, you go and you see this is much better, and they say yes, but I will not get paid for that, so I will not do it. Yeah, that's a very interesting point.
Yeah. And just to add a new point of view, we don't have to forget that in other countries it is happening. So in a massive way, there are countries as United States and other countries that has the legislation that allows them to implement that in a very radical way. I like very much also the point of view of César. He says that it has to be a process that has to be changed for all. And this vision also I share with some of the hospitals that we are working, that I see that they bet for real innovation, and they change all the process. And of course, it has to bring a learning from the organization, and it has to be a process. But at the end, it is happening also in other countries. So maybe we have to think what we can do here to really make it happen.
But yeah, you name it. I mean, regulation is an issue because regulation is a big constraint in many innovations. Well, we publish it in the hub. All what we see as the change that should be done to enable telemedicine in this country, which is not fully, we don't have the full ability to provide telemedicine in a natural way as it's done in other countries. So, well, framework in regulation. What do you think that should be changed, or we should address to become more, to see more hospitals go liquid?
Okay, it's interesting because I think that we have different speeds. The innovation It's going fast, very fast. You know, we as an insurance company, we invest in other companies with innovation products, and we try to bring those products to our clients, and sometimes we are much ahead of their speed. So, as you say, this different speed it's a problem. It's a problem. So that's another point to work with the government, you know, to be more aware of what the industry, the innovation industry needs. We need a framework, you know, as fast as the innovation goes, and that's a big deal. And you know, hopefully, you know, in the future we will have that. But you know, we have to ask them to go faster.
Now,
yeah, I absolutely agree. I think regulation and development of new technology needs to put everyone in place, so government, academia, industry, and patient and population to make it happen. And now I think regulation, it's needed, of course, also in data, that now talking about digital health mainly is in data and data protection, but we should find ways of creating sandboxes or spaces that are protected enough to accelerate some of these solutions to get to the patient and to the market.
And also for adding something from another point of view, it's true that the technology it's going like very fast and regulatory is not there, but also the people the companies that we are working in technology, we have to fulfill like all the compliance and all the regulations. For example, the CE mark. If we are like putting any insight from the patients or others as the GDPR or HIPAA compliance. So that's something that maybe it's needed to have this formation and these implementations. I think that the technologies companies, we are working in a very serious space, which is health, and we need to fulfill all the things. And the most important also, we have to show evidence of the things that we do, that it is not, well, sometimes regulation involves that you have demonstrate evidence, of course, the CE mark class 2 and others, or 1. But I think that it's important that from the other side, the little regulation that we have, that we, of course, fulfill all the requirements that they ask.
okay, so you want to add something?
No, I think everything is.
Good. So, well, moving to another big deal, which is public offerings. I mean, of course, private hospitals can do their job, and I think they are doing it well, I know from direct experience that they are thinking about ways of doing things different. Maybe in the public hospitals we have another constraint, which is that everything has to go through a public offering. And this is a big constraint. And I don't know your thoughts about it. Arnau, you want to start with it?
I agree. Of course, there's challenges. I think also there's some solutions tried to be in place, like the public procurement and programs like that to try to accelerate this. But I think there's an opportunity. So the capacity and the resources of the public system could be a pusher for the change, and creating more initiatives like the public procurement, for example, so that can help accelerate all this change and be applied on the public system. And also there's an opportunity on what César was explaining at the beginning, on the connection between primary care and tertiary complex acute care in hospitals.
Yeah, here for me, like there are like two important things. The times are very important in the implementation of any technology, and in my opinion, the public offerings kills this implementation, because for a technology company, 2 years, maybe we can launch different products or 3 different products, and the times are very important, and the public administration has to listen and also see what are the times for also like the development and implementation. This is the first thing. And the second thing, I think that the bad get has to follow any kind of a strategy. So for me, to buy like medical equipment, in my opinion, it's not just that. So it's not like a digital transformation. So maybe the strategy has to be very oriented and aligned with technology development, because these kind of public procurements, they are also like thinking in some regions for innovation, and it has to bring real innovation, not like equipment itself. exactly.
Sure. You want to add?
No, I think probably you have to rethink the procurement like you are getting, because probably you have to add something, not probably the point of view of the patient, but probably the results of the patients in there. And then sometimes you are only putting the price or putting the price first, and probably you have to change this.
Oh, sure. And some of the things that you said reminds me of my old job. I was in the food industry
Yeah.
for many times, for many years, sorry. And at that time we had the factories, and we had the sales team and the marketing team. And sometimes you feel like they work against each other, because of course the factory wants to have the best product, the lower cost, and this may not fit well in the market with the sales guys. And somehow I see these ideas in the things that we commented. I mean, we can put the focus in the production and in the cost, or we can put the focus on what is the expectations of the user. And it's difficult to balance. Even big companies have challenges balancing this equation, and some companies are clearly to one extreme and others to the other. But I think that in healthcare we are more on the outcome-based service. The important is the outcome. So, well, we are reaching almost the end. We have some questions from the audience. Please try to be really quick so we can go. What would be the best approach for a hospital to go liquid? This is a question that was launched. I don't know if any of you want to take it.
To put a patient.
To be patient. I think to be patient is
To be patient
important.
and to work with patients.
So also, well, they already talk, and they made me think about this manufacturing and the double sense in all of these. But also, they talk about if you want to give some concrete examples that happen here with the liquid hospital. I think that we already commented some of them.
I can add one if you want.
Okay.
We are working in heart failure with the Hospital of Torrevieja, and in that case, the patients that are in readmission, they go with a pack of devices, of medical devices, and they get monitored at home. And here, I think that it's very important in this experience because one of the main things that we have experienced are mainly three outcomes. The first of all is that we have demonstrated that this unit can reduce 33% of the visits to emergency, and this study is published, so you can find it. And the second one is that the data that is generated outside of the hospital, it is reused for taking a better insights and a better clinical decisions, and this is important. So we are using an opportunity that were missed. And finally, that the patients, that most of them are elderly, they can use it. There is also like a lot of stigma of elderly people, but elderly people, well, it depends on what elderly people you think it is, but they can use it and they want it.
Good. So to finalize, please provide your advice to the industry, to the people that we have here. What should we do to go forward with this concept of liquid hospital?
For me, it's three things. Don't get excuses. Change problems into opportunities, because we can do it. And at the end, work in a human-centric way with patients, of course, because you can put an excuse that the regulation that you cannot work with patients, you can work with patients and you can change the way of working.
I think that for me is that we have to have an holistic view of the system, you know, and try to make that a common vision, and see, you know, what's going on and what we want to happen for the future, and how will we be treated, you know, And if we sit down and talk about this, this could be the first step. No, maybe now we are very apart one from the others, and we have to to get closer and to talk firmly about this situation and making plans for in long term about the care.
Yeah, for me, there's an opportunity here of efficiency, of better delivery of healthcare, and improvement of patient experience. So I think it's, as I said, an organizational change that needs to ask patients, to ask professionals, and put all the people there, and start small with some examples, and then keep growing, taking into account what outcome you want to achieve. So also adding this part of analytical view on that.
For being because we're out of time, very quickly, results and evidence are there, and it has demonstrated the value. So now I think that it's the time to shift the mind and to really implement it and implement it in the workflow of the hospital.
No, thank you very much. Thank you for your contributions. I think that was very interesting. We raised a lot of good ideas, and I'm sure that a lot of people enjoyed this discussion. So now we have to move forward with the agenda, and we'll leave it to Elena to continue. Thank you very much.
Thank you.
Thank you, but before, Christian, before, if you don't mind waiting here, just for a family photo, maybe just right there with the VHH Summit on the backward.